So I think the future for JAK inhibition and MPN is in two different veins. One are newer, better JAK inhibitors. There's a lot of interest in the type 2 JAK inhibition. There's a drug in development that's entering clinical trials now. Type 2 works a little bit differently than type 1. So type 1's being ruxolitinib, momelotinib, and the like, where it works on the active conformation. The type 2 works on the inactive conformation. So it's really going deeper and harder at JAK inhibition, with the thought that it could root out disease in a much more deeper and even more meaningful way. So we all got our eye on type 2 inhibitors. But the other future for JAK inhibition is serving as a backbone for combination therapy. JAK inhibitors, particularly ruxolitinib, is phenomenal at treating spleens and symptoms, but it lacks at killing off myelofibrosis cells or MPN cells in general. So combining with BET inhibition, BCL-X, BCL-2 inhibitors, with MDM2 inhibitors, export inhibitors, and so on and so forth, really to, one, treat the symptoms and kind of the top line issues with the disease, but then two, really root out disease, deepen those responses, make those responses more durable, leading to better quality of life for patients as well as quantity of life.